4 News Weekend.
As our troops come home from Iraq, they face a whole new set of battles. Coming up on KRON 4 News Weekend, we'll discuss the mental challenges that await the soldiers. The last of American troops have now left Iraq, ending the nearly 9-year war there. This was the scene as the last U.S. forces left from an Air Force base in Kuwait, closing the gate behind them. NATO has also announced it will withdraw all of its troops by December 31st.
The thousands of troops returning home from Iraq will be facing post-traumatic stress, anxiety, even depression in some cases.
The ways to treat these soldiers has not always been clear-cut, and joining us this morning is psychiatrist Dr. Xenakis. He's also a veteran who served in the Medical Army Corps, and he advised top military leaders about the troops' psychological health. Thanks for joining us this morning.
Good morning. Thanks for having me.
Let me ask you, are the mental scars and wounds that you might detail all PTSD related, or do you need to look at a broader diagnosis?
I think you do need to look at all the considerations. This war particularly has introduced the IED, the improvised explosive device. That's been a game changer. We haven't seen something like that, perhaps where we've had such explosions that affected the soldiers and caused the kind of symptoms that you get with concussions. So any number of them on many, many deployments and missions have had these events happen to them. So you have that. You have the emotional stress. It's an environment that's been harsh, so it's got toxins there, and it's got other environmental factors we don't see over here. I think it's best to look at the whole picture of what these soldiers experienced and thinking about what they're going through now and how best to treat them.
As they begin to come home and are seeking treatment, you talked about some of the tools that you use. Explain what you have here and how that's used.
This is a cap that we use to do EEG, which is electroencephalogram. It's a brainwave test. It's an office-based procedure. It's very easy and rather comparatively inexpensive. You can do this test for a couple purposes. One is you can get you can analyze the information and detect what is some evidence of them having had a concussion, and to see if their symptoms of inattention, or a lot of them have anger management or sleep problems, are due to the emotional problems, depression or anxiety, or is it in fact a concussion. The other thing is you can also analyze the data and see what medications might work best with them. It takes the trial and error out of the prescriptions.
And with a lot of the people having come home over these 9 years, there's probably case histories that you can look at, and not just the newest members coming back. But is the military acknowledging all of these issues and giving everybody what they need? We've heard stories where a lot of vets are still not getting the kind of mental treatment they need.
Yeah, I think that both the military, the Department of Defense, and the VA are making a real conscientious effort to do what needs to be done. It's just hard. I mean, we've had 2.5 million men and women over 9-10 years who have deployed to Iraq and Afghanistan, some of them many times. And they're all changed. You know, this has been an incredible experience for these young folks. And so that at one point or another, they've probably all got something that bothers them. Well, if it's what, 30%, 40% of 2.5 million that have been affected? I mean, that's close to 1 million folks. That's a public health challenge here. And so these systems, you know, to go out and get them into treatment is going to be an incredible effort. And so we need to put a lot of energy into access.
And it's not just about drugs. I'm sorry, Marty. It's not just about drugs, then.
No,
giving them drugs and taking care of the problem.
In fact, in many cases, the soldiers will tell you they'd rather not take medications. I mean, the medications do help, but they also make them feel different, you know, and if they're in active duty, then it can diminish their reaction times and their sort of visual acuity. They'd rather talk it out.
Let's talk for a second about the drug issue, because one of the stats that you have is astonishing, and that is that 1/3 of the soldiers, you believe, are addicted to pain medication?
Well, are on Medicaid and maybe overusing them. I think a number of them, you know, look, these guys have been carrying these 90-pound packs on all these deployments. They've got a lot of aches and pains, and they very commonly, the first thing we do is give them pain meds. And so maybe not addicted, but they're clearly overusing them, and they're clearly getting into trouble.
Doctor, we have like seconds, but what is the impact on society as a whole?
Well, I mean, society could see that they've got a lot of young men and women out there that may not be employable, are looking for employment. I think the employers are doing well and worried about can they bring these people into the workforce? Are they going to be homeless? Are they going to get into trouble? Are we going to find them in jail? This is how these public health things roll out. So it could have an effect.
It'll be the next chapter in the war in Iraq and Afghanistan.
Appreciate you coming by.
Dr. Stephen
Thank you
Xenakis.
so much.
Thank you.
Yeah, thanks.
And this is some information on Dr. Xenakis' program. The phone number to call, 877-507-0555. The website you can go to is www.cnsresponse.com.